As a family doctor, I have a lot of patients in my practice who have to make tough choices every month as relates to their medications. In one case, I have been following a family now for about 7 years, two adults, 2 parents, and 3 beautiful young children. She stays at home with their kids currently, and he drives a taxi. So he's the sole income earner in the household, and he works really hard. He works really long hours, and they do fine, but there's not a lot of money left over at the end of the month. And unfortunately, over the time that I've been taking care of him, he's developed diabetes, high blood pressure, and high cholesterol, 3 things that often go together and that put him at serious risk over time of developing heart disease or having a stroke, all of which would be devastating not only for him and his family, but also in terms of healthcare system costs. We were having a hard time getting his blood sugar and his blood pressure under control. Sometimes he would come in and it would be great, and then other times he would come in and it would be terrible, and I was having difficulty figuring out why. And finally we had a frank conversation about his medication, and it turned out actually that he couldn't always take his medication. He could only take it sometimes, and sometimes he wouldn't come to see me for 6 months or more because he wasn't able to afford to take his medicine, and he knew that his numbers would be off, and he was embarrassed to tell me that he simply couldn't choose between feeding his family and paying for his medically necessary medication. And for me, this story just, I mean, first of all, it breaks your heart, but secondly, it illustrates a much bigger problem, which is that when we pinch a penny, we lose track of the dollars and dollars that are saved in the healthcare system if we can manage disease, chronic disease, early and effectively, instead of waiting for it to get completely out of control and then managing the complications in a hospital setting. I think about him a lot. I think about the issue, the broad issue that his situation raises, which is how crazy we are when we try to save a penny, when in the long term it's going to cost dollars and dollars to manage the complications of diseases that we could easily have prevented if we had paid for people's medications in the first place. It doesn't make sense from an economic point of view, and it certainly doesn't make sense from a human point of view when you realize that these are real people whose lives can be seriously affected and whose health can be seriously affected by not having access to medically necessary medications. The support that Canadians have for Medicare is overwhelming. You know, poll after poll after poll, and at the electoral polls in every cycle, we see Canadians putting their support behind the notion that access to healthcare should be based on need, not ability to pay. And that fundamental notion of equity is what underpins Medicare and underpins the design of our entire system. But at the time that the system was designed, medication and coverage for medications was not as big an issue as it is today. Now we understand that a critical part of managing illness in modern medicine includes the use of medications. And it's time to apply that basic principle of fairness, access to care based on need rather than ability to pay, not just to doctors and hospitals, but access to essential life-saving medications as well.